this is Messalina Jordan.
It
And
is.
she is another DPC physician in our area. So that makes, there's four of us. This is the third interview. So this is four of it. There's four of us in this really small area of the state, which is really amazing, which we were talking about earlier. So the main things that we're asking basically are when you got started was how long ago?
3 years ago, May 2019, and I was the first one that was in that Marshall County area.
Yes.
The first one.
So 3 years ago would have been 2019?
2019.
Okay.
May 2019.
And then, and you just did DPC then.
That's correct.
Right. And you just have started trying to incorporate, you're going to be like me, you're going to be a hybrid clinic.
Correct.
And you're trying to incorporate some insurance.
Correct.
So I kind of went the other way, did insurance and then DPC. So how did you find out about it? And what made you want to do DPC?
So I'm going to tell you how I found out about it. This was the funny part right here. So I was a faculty over at the University of Alabama, Tuscaloosa Family Medicine Residency Program. And we were going to one of the graduation. And so, you usually ask them, so what you going to do when you grow up? What you going to do? So I was asking all the residents that. And one of the residents said, I'm going to do DPC. I'm like, what the heck is DPC? And he told me what DPC was. I said, you better get yourself a real job. I'm sorry.
Was that Susan's son who was doing that? Susan?
No, his name is, Chad was the one.
Was it Chad Williamson?
No, it wasn't Chad Williamson, but Chad Williamson was the one brought him on.
Ah, okay. He's in Birmingham.
Yes,
yes,
exactly.
I know who you're talking about. I can't remember his name.
It was him, but yeah, so I said, you better get yourself a real job. And I didn't know anything about DPC. I had never heard about DPC. But I started talking to him, and that was it. That was it.
Yeah.
So
that made you want to do it.
No, when he told me,
didn't? Oh, okay.
I said,
so
okay. I just told him you better get yourself a real job. That's what I told him. I said, I'm going to show you how to get a real job.
Yeah.
And that was it. Well, I went on a vacation from Tuscaloosa. We had to go on vacation.
Yeah.
And then I was driving down, and I'm OCD about my notes. So as I was coming home, I was telling my husband, oh my gosh, I got to do notes. I was already threatening about the notes. And I said, I said, so-and-so said that he was doing DPC. Let me look up DPC. So my husband was driving, and I promise you, he was driving. We were driving from Panama Beach, and we were driving back to Tuscaloosa. And I was reading through. I said, oh my gosh. I said, Charles, you know what I was telling you? The reason why I wouldn't be on my own, I will always be an employee, is because I didn't want to have to deal with the insurance. I didn't want to have to deal with the startup money and everything. And I said, oh my gosh, I said, Charles, guess what? I said, I don't have to. I said, that guy, I was telling him about my story, my conversation that I had with him. And I started looking it up. So guess what? And I called him up. And
Say,
I was
buddy.
like, I did. I said, when you were telling me about DPC, tell me a little bit more about DPC.
Yeah.
And he said, well, I got Chad Williamson. You know Chad? I said, you lie. Not Chad Williamson, not the medical student that was at Huntsville when I was.
And he was under you or his attending.
That's what I'm saying.
Yep.
I said,
he told us
Chad.
that today.
I know Chad. So
Yeah.
I went ahead and looked him up because I still had his phone number as a medical student. This guy has kids and everything.
He does. He has 3 kids.
I did, and I started talking to him more about it, and I was like, oh my gosh. I said, Charles, I had prayed about this. I said, I always wanted to be my business, but I didn't want to do the traditional insurance business.
Right.
Because I just felt like I was just always hurting them in, hurting them out. I love to talk.
Yeah.
So I was never on the one that was getting the bonus because I always spent too much time with the patient. So I felt like I was always getting penalized.
Oh, yeah.
Always getting penalized. You're not seeing enough. You're staying too long. Your appointments are running over. I'm like, well, I just want to talk to the folks. So that's how I really got started. So that was
That is so cool.
It was, and then I called Chad, and it's so funny. So when I called Chad, and I was telling him what I wanted to do, and Chad was like, "Wait a minute, where are you trying to put this clinic?"
Albertville, because he had 2 clinics there.
No, he hadn't had
one.
one.
He didn't have one yet.
No, he didn't. He said, that's where I'm trying to be in Boaz.
Yeah.
He was working as an ER doc there, and so was I. And I was like, really? He said, when you talking about putting one in? And I told him. And the next thing I know, Dr. Morgan Goss came down the way, and he was giving me all kind of pointers. So I asked him a lot because he's pretty much the guru around here. Yeah. And I didn't really know Dr. Goss at the time.
Right.
But
she came from Florida.
Yeah. So I kind of talked with Chad, and next thing you know, he helped me out, and Everything is history, and I love it. Oh my gosh, I love it.
Yeah.
I love it.
Yep.
I'm being the doctor that I wanted to be.
Good.
I really am.
So we were looking at each clinic, and so Chad has he has his clinic, and then he has a gym membership that goes with it. Then I do all this weird stuff with gardening and eggs and you know all that. So what do you feel your specialty is? Is it like women's? Is it women's and children?
It's women's and
That's
it's
what I
women and
figured.
children, right?
Because
It's
how many
OB.
babies had you delivered?
Well, by the time I left Huntsville, because I did women's and children there, and then I went to Kansas, and I had my personal practice there up under the local hospital.
Yeah.
And then I went to Northport, and I went to DCH in Tuscaloosa.
Yes.
So I'm talking about between all of that, probably a good 3,000 babies.
Wow.
And I fell in love when I was in medical school. I had no desire. I was a nurse for 23 years. The only thing I did was adult medicine. I didn't want to go on a medical surge. I didn't want to mess with women.
Yeah.
I didn't
So
want to mess
you
with
were
kids.
older like me in medical school. That's right.
42. I went to medical school at age 42.
And I was 40. Or turned up 40 my first
Yeah.
year. So we have that in common.
Yes, yes,
Yeah,
yes.
I forgot about that. So
Yes,
you were
I did
older,
that.
not as young as the rest of them.
And so I stayed an extra year in family medicine residency just to get surgical obstetric under my belt and women's health and put in all kind of, IUDs and stuff. And I just enjoyed it. And I still do. But I didn't realize how much the delivery took of my time.
Yeah.
Because I just loved delivering. On my, while I was in residency, we only had to have 40 deliveries, but 20 to actually, to get that certificate. So at 20, everybody was giving me their deliveries. On my off days, on my vacation, I was going to hang out with the personal, the private OBs.
Yeah.
And so I just got known for delivering babies. And but when I got married, and I came to Marshall County, and I was like, man, I got a family now. I can't be up in the hospital all the time.
Right.
But I think I did pray on it, and I said the Lord gave me that skill. That's not my skill. It's my skill for the community. And so delivering, I wouldn't have had an impact on it. But I think to take care of OB patients that cannot afford the OB care, so that was my prime reason for now. What I do is I do prenatal care.
Yeah, so what happens is we have a lot of women, especially Hispanic women, who don't have health insurance when they're pregnant. And so they can't always get Medicaid. They have to pay for their visits all the way down. So this way she can provide their prenatal care and get really good prenatal care instead of a lot of women will wait until the day they have that baby and go in that hospital and have it.
Yes.
And that's not a good thing.
It's not.
It's kind of dangerous.
It is.
So she's able to give prenatal care to a lot of these folks through DPC.
So you were an OB nurse before?
No, that's
No.
just it. I was a regular not med surge, but I worked in intensive care units, open heart recovery, surgical intensive care unit, the cardiac unit. I never I had no desire
To do
work.
women and
I had
children
no desire.
or babies.
But when I was a medical student and that was my rotation, I was like, oh my gosh, this is God's given right here.
Yeah.
And I love to smell them too. I love smelling those babies.
Smelling new babies.
Oh my gosh, I love smelling, and
Yeah.
God just laid it on my heart just to be a part of that.
Yeah. So what is your favorite part about doing DPC?
No restrictions.
Yeah.
It really is. I give my examples to my patients all the time. I give them the same scenario, and I said, now the insurance company said I couldn't do this. I get to do this with you.
Yeah.
I said I get to spend my time with you. I don't have to check all these boxes just to get reimbursed. I say half time talking to our patients in the first couple of minutes, we know what we need to do. But if we don't put that extra stuff in from what the insurance says that's required, then we know we don't get reimbursed. So if I have to say anything about DPC, I just get to be me, my patients get to be them. I don't have all the
That's
restrictions
great.
and the checkpoints in place in order just to treat them.
Yeah.
And I think my patients appreciate it too.
Yep.
Because a lot of time, to be honest with you, we end up talking about them. That's the real reason why you're here. You just get that unconditional just time with them, and they get to see you as being not just their provider, but they do become close friends.
Yep.
I have a lot of friends that are DPC, whereas my other patients, they see me as well, but they come as they need it. Whereas my DPC, they feel like, okay, I can come just talk to Dr. J. And not have to worry about that extra copay. what I'm saying?
Yep.
Or just have to, take it up her time because I got that time to sit here and
Yep.
talk with her. So if I have to say about DPC, it's just really the restrictions and the checkpoints just are not there compared to what it is when I have to work with my insurance patients.
Yep.
And I just think that's so important. And they don't feel rushed out.
Exactly.
Yep. They don't feel,
we see that every day with our direct primary care. So what do you see going forward
with my DPC.
with your clinic in general, period?
Having my population where my OB is really revved up my Wells Women's Health. Because like you said, the clientele that I serve, either they can't afford it or they don't see a need for it. So, and just getting rid of people to take care of themselves. I tell people all the time, my practice is about self-preservation. So I teach them, and I try to get them to see the value in themselves. Because what they want to see their care as an expense. And I'm trying to get them to say it's not an expense. It's an investment. If you don't invest in it now, when you get to be my age, you're going to wish you had her. And I tell folks, I know what you've been doing when you were younger because it shows up. It shows up. It does. So
It does.
if I have to say to wear my direction, I want people to just really see that the investment in themselves. And a lot of them, they're a caregiver for other folks. But they don't see the need and take care of themselves.
Yeah.
Like, if you don't take care of yourself, how can you take care of them?
Right.
So if I can get the community to see the investment in themselves, self-preservation.
Yep.
That's what I call it.
That's absolutely
You
right.
know, and I do tell them, and some of the stuff that we as providers have developed, where they feel as though they can't get sick. Oh my goodness! I gotta go on a vacation. I can't be sick. Can I get that shot? No, that is not a diagnosis. I can't get sick. But they feel as though it is. I'm going on a trip. Oh, I got a meeting. I get it, but I can't give you just because you don't want to get sick for that meeting. I get it, but I promise you, I get it. I totally
we
get
can't
it.
pre-treat something that doesn't happen.
That's it.
Yeah.
Exactly. I said that's not even an ICD-10 code for that. But I do. But one thing I have to say, because my husband, he told me, he said, when you come here, trying to change the culture on the mountain, it's going to be hard.
Yeah.
They think they're supposed to get that Roseffa, and they think they're supposed to get the steroids.
Yep.
And I tell them, I might bend on the steroids, but not after I've told you about the osteoporosis, about the diabetes, about the you could get pneumonia earlier.
Congestive heart failure. Yep.
I told him. I said, and then when you tell me you want, I say it out loud. I'm putting it in your chart. So when that Electronara commercial come on, have you been having steroids? You call me. You're going to get to call them and you're going to say, oh, shoot, she put that in my chart. She told me all of that. I said, I tell her that. I do. I said, but I won't budge.
She's a new patient today, brand new. So she's hearing your interview.
I do. But one thing I don't budge on my antibiotics.
Yep, me either.
And why don't I do that? Because I haven't had antibiotics problem in about 20 years. I have 4 kids, and I can count on hand all the antibiotics they've had as a child. And right now to this day, they don't do antibiotics.
Yep.
I said, but just because I don't have your bug, if I get your bug is multi-drug resistant, it doesn't matter that I haven't had any antibiotics.
Yep.
I get your bug.
Yes.
And the community get your bug. Those 2 hospitals we got in Marshall County, they get closed down because of your bug. Because we didn't want you to get sick for that meeting. And now that you weren't going to get sick, that you even need antibiotics.
Right.
So, if I could get that message out.
There's a lot of messages we need to get out there, aren't there?
I know, but we have done as providers.
Yeah.
We're trying to correct that.
Yeah.
We don't want to make our patients mad at us.
Right.
We want to give them what they want because we want them to come back. But you know, our Hippocratic oath said, first do no harm.
Yep.
And that is doing harm to them. So
And they learn, because
do.
I've been here almost 14 and a half years, and they learned that I don't give antibiotics.
and they teach
And
you.
they're okay with it.
That's it.
They're okay with it.
That's it. And my husband, he'll say to me, he said, well, what if they go? They want that's okay. I'm
They
not
go
for
down
everybody.
to urgent care, whatever.
I'm not for everybody.
Yep.
And I got been known as non-vaccinator. How that is because I think if you're a parent, you made the decision to have that baby. You made the decision. You made a decision on that job. Mm-hmm. You made the decision on to get that insurance or what not to get insurance. How am I going to tell you what to do about your kid?
Yeah.
But I'll tell you what I've been trained. And I said, even my non-vaccinators taught me a whole lot. I've been reading a whole lot about non-vaccinators, and they do have a point.
Yeah, to some degree.
They
And
do.
I'm like you.
They do.
My kids have all been vaccinated.
Yeah, mine
but,
too.
You know, if somebody comes to me, I'm going to take care of them no matter what.
Because they get sick too.
Yep.
And I tell them, I said, Mom, I have to do a little extra work on your kid because your kid shouldn't be getting this, but because your kid is not vaccinated, I have to pursue those things that we don't normally get anymore.
Right.
I said, but if you're okay with that, or letting your kid go around some of these kids that have some of this bad stuff, I'm okay with it. But sick kids get, non-vaccinated kids get sick too.
Yeah.
And so I'm here for you, and I'm gonna give you my information, how I've been trained, and I'm gonna read yours.
Yep.
You
Very
know,
good.
so that's pretty much so how I run my practice. It's a collaboration between myself and my patients.
So we have similar ideas.
It is. It really is, because
Yeah.
I'm not here just to tell you what to do. I'm here to let you make informed decisions about what I'm asking you to do.